Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan. In today's video, we will be discussing about a newly launched journal, which is Practical Evidence in Anaesthesia Knowledge, which is an open access peer-reviewed journal, which is committed to publishing high quality articles in the field of anesthesiology. Now, the journal is owned by the College of Indian Society of Anaesthesiologists and is published by Scientific Scholar. Now, to talk to us about this journal in detail, we have with us today the Editor-in-Chief, Dr.Sukhminder Bajwa, the Honourable Secretary of the Indian Society of Anaesthesiologists, India. Dr. Bajwa is the Professor and the Head of Department of Anaesthesiology and Critical Care, Gian Sagar Medical College and Hospital, Patiala, Punjab, India. So welcome to Medical Dialogue, sir. It's really a privilege to be having you on board here with us today.
Thank you, Nanta. It is a really pleasure to be part of the Medical Dialogues team's interview. I was looking forward to it.
Great. Now, sir, firstly, congratulations on the newly launched journal. We're talking about the Practical Evidence in Anaesthesia Knowledge, which is also abbreviated as PEAK. So if you could just if you could just tell us about ISA first, its history in brief, and how actually the society has been serving the healthcare fraternity in India.
So ISA, that is the Indian Society of Anaesthesiologists, is a professional and academic organization. It came into existence, I think the thought was conceived in 1944. At that time, we were still under the rules of the British. And after the independence in the 1947, so the idea which was conceived earlier came into existence and the society was formed at KEM Hospital, Mumbai. And the first conference of ISA was also held in 23rd to 24th December 1949 at State Medical College and KEM Hospital, Mumbai. And thereafter that office bearers came into existence, and then Dr. Ahmed Desai was the president, Dr. B.N. Sarkar was the secretary, and Dr. Talwalkar was the first treasurer of the society. And that conference was a part of the Surgical and Obstetric Society. So three societies together were doing that conference. So the contributing towards the medical care. They went on to do the conferences till 64, and ISA first did its independent conference in 1965. And the journal, we had conceived the ideas of a journal in the rules and regulation protocols were formed in 1949 only. But the first issue came in 1953 under the leadership of Dr. Ganguly. He was the first editor-in-chief of IJ, Indian Journal of Anesthesia. Bringing out the journal means that we are contributing academically to the growth of our fraternity, society, specialty, as well as giving us the pathways, the advisories, the guidelines, the academic platform for various members of our specialty throughout the country. So right from that, it's almost, we have celebrated the Platinum Jubilee 2 years back, and over the years, 75 years or 77 years rather, we have been contributing towards the academic growth and excellence of our specialty, and it has really taken a long way for ISA to make its exist in the world as the fourth largest society in the world on an active basis and second largest in the world after American Society of Anesthesiologists. And we have made a mark. We have been a part of the founder member of the WFSA, the World Federation Society of Anesthesiology, in 1956. And thereafter, 1978, we had this one, Asian Australasian Society, and then 91 for the South Asian Confederation of Anesthesiologists. So ISA has been active in the academic and professional growth of all anesthesiologists right from the independence, and we are contributing handsomely through journals, through our literature, conferences, CMEs, and all academic and non-academic events. So that's how the ISA is helping its professional to build up the rapport and to bring out the best in them. This is the brief history of IS.
Great. ISA definitely has come a long way. It dates back to, as you mentioned, 1944. So it's definitely has come a really long way. Now, so we're talking about this new journal, Peak, as we have abbreviated it. So if you could just tell us about this, and while the society has it already has its famous official journal, that is the Indian Journal of Anesthesia. Why do you think was there a need to launch this new journal, Peak?
So we are running very successfully the Indian Journal of Anesthesia, which is the mouthpiece of ISA throughout the globe. Started in '53, it has made a tremendous progress, and I've been associated with the IJ as a reviewer for almost more than 2.5 decades, and as an editor, so as assistant and associate editor since 2009, and in 2019 I became the associate editor in chief of the journal. At that time, I got the free hand in editing the journal. I was so much, enthusiastic about editing it, and my team, we really did very hard work. So whatever the pathway and whatever the platform has been prepared by the previous editors, we took it from there and took the journal to almost 2.9 clarivate factor, which is existing in 2022. And our new editorial team was also maintaining the same momentum. The growth is stupendous, if you ask me, for the IJ. And in the global level also, IJ has made a name of its own. It's carved a niche for itself. But somehow, what happens, because the society is growing at a very large pace. We are almost around nearing 50,000 members. And considering the growth of the society in near future, in the next 10 years, in 1 decade, we will be 1 lakh member society. Catering to the 1 lakh member society is not possible for one journal, especially in the background of that NMC has its norms of having 2 to 4 publications, 2 from assistant to associate and 4 from associate to professor, whatever the first, second, third or corresponding authors. So many numbers of teachers are there. That has given birth to the predatory journals. Predatory journal means they are taking the money for publishing the articles, and those may be PubMed indexed, but somehow it is become a necessary evil. And our specialty people, our anesthesia fraternity, they are publishing those predatory journals, and we are also losing a huge revenue on those accounts, as well as the quality of research is never taken into account. You give money and that articles get published. So catering to all these needs, there was a need felt that it's not just Peak. We are in the pipeline of starting many more journals in the coming days also, because our College of Indian Society of Anaesthesiologists, which came into existence 1 year back. So its main aim is to give more academic wings to the society, and journal is also one of the way and means to go forward in the professional front. So that means the Peak and a scientific scholar. I had a long duration of experience with the Medno and Walters Kluwer, but when I got associated with the scientific scholar, I think it was a much better thing for me to understand that this publishing house is catering to a quality work, the publishing system, the manuscript submission system, as well as the quality of editing. You must have seen the first issue which came out. It was a very quality issue from all aspects. So considering all these aspects, the birth of Peak occurred after approval from all the governing council members, because that need was felt uniformly across the nation. This was the, I think, main reason behind the birth of Peak.
Great, sir. Now, sir, according to you, what is the state of clinical research in our country? What are the current challenges, and if you could just highlight on the possible solutions also for them, and how new journals like yours, the Peak Journal, would help younger researchers to actually bring their ideas to a larger population?
So this is a very tough question for me. That's providing solution to a problem which is prevalent since a long time. I'm not the right and appropriate person, because it is always a team effort, the policy making with the governments, then the intent of the managements of the institutions, the administration. So many factors are there. If you ask me honestly, research has not gained that much momentum which it should have been till date, because NMC has also come out with its policies in 2013-14 when they make it necessary to have publications to go forward. By having such policies without any proper, a structure or a background, it has given to a little bit of fallacious research also. Research, rampant research which may not have a quality, they may have a quantity, the quality is not there. The research scenario in India as such, it is not being respected by one and all in the Western world because they think that the quality of research is poor, the infrastructure, the funding is irregular, the funding is not uniform, the opportunities for every researchers are not uniform. There are centers of excellence, the top premier institutes of the country. They are doing a good research work, but the same thing may not be happening in the peripheral institutions or the corporate hospitals. There are so many factors are there which it's difficult to outline each and every single factor here in this small talk. But going forward, we still see that research is the only way of proving yourself, of proving the credibility of our Indian medical fraternity to the globe, that we are no less than anybody else because we have got a number of patients are maximum in this country. The opportunities, the study material, and also the intent of the people. They really want to do excel at this level. The only thing is the policy making, if it comes to align with the research methodology. And coming to that part also, I remembered the research methodology knowledge is also very poor in our country because we formed the research methodology module of ISA in 2015, and it's almost a decade now. People didn't have a proper statistical, tools and techniques to evaluate their studies, to form even a research question properly. So with that module, we started spreading the awareness and knowledge about how the proper research should be conducted. I think that's how we went in the last one decade. It has made a difference. And if we go more strong, we will be having another 10 years down the line. I think the research scenario will definitely improve, at least in anesthesia specialty, because we are doing very much hard work on that module. So this is the real state. Rest, the bigger part of the things may not be, I'm not the right person to answer those questions. So this is just a humble submission from my side.
Yes, definitely, sir. Now, you talked about funding. Now, if I may just highlight, if you could just share your views about the idea about and also your ideas about the state of research funding in our country. Now, you mentioned about central universities, peripheral universities. So, how can these peripheral medical universities can actually come up to the mainstream hospitals and research institutes to carry out their research?
See, that's a very pertinent question if you ask me from research point of view. But from administrative point of view, these things are very, very difficult to handle. See, now one of the biggest agencies is the ICMR. Now, in my institutions, I tried 2 times. Even if you have got the maximum publication in Asia, you try the research. The ICMR becomes so biased that it always allows the only some institution with good repo name. They just try to fund those institutions only. My students here, they tried their best, putting up the best research papers, best research questions, best study models for that funding. It was not given, or it was not granted. Although I have got my personal, acquaintances in the ICMR, but I didn't follow those. Somehow that has to be sorted out. You just can't go like that only funding only a few premier institutes and the research is confined only to those institutions. Peripheral universities, definitely they also require support, not just in the name of funding, but in the faculty, in the multicentric trials. Because many times what happens, if the knowledge is not adequate, the research methodology is not adopted in entirety, the best way to go forward is the multicentric study, where you can always share ideas, having a meeting at least once or twice in a month, where you can develop on the study plans, how to go further, what are the limitations, you discuss everything. The multicentric trial is one. Then you encourage not just the peripheral university, the peripheral hospitals. 60 to 70% of the surgical load is on these peripheral hospitals in the country. And the maximum amount of surgeries are carried out in those hospitals. You may not be knowing, so many good cases are always done, so many good ideas are always executed at that particular level. And the practitioners, they are not willing to share their ideas, or sometimes they find that it's not their cup of tea. The research, writing a research a letter to editor even, or a case report or something, reporting about a particular adventurous event or something, an anticipated event or something, a very complicated scenario. So those things go unnoticed. Those goes not documented in our literature, and we are losing a lot on the occasion of that. So how we can proceed forward is encouraging these people. So in the peak also, we are giving opportunity to all these people. Not peak, even the IJ, we are doing the same thing. IJ though is already doing for the many years. Peak also has come out with this proposition that we will be especially encouraging the youngsters as well as the practitioners to contribute whatever the good interesting case that is. That will send a good message. It will inculcate a good practice of anesthesia, as well as do a brainstorming session to start a new research work in that particular complicated scenarios. So that's the only way I think to go forward. You involve almost every part of the country where small institutions are there, where single individual practitioners are there, and only by involving them you can have a very comprehensive and holistic research. Otherwise, it will be remaining confined to the premier institutes, where I think the whatever the study results you are getting may not be representative of the entire country. That is my take on this question.
Very well said, sir. Definitely, the peripheral institutes also need to benefit. Only then there will be a guiding force, or probably an encouragement for young practitioners from such universities to actually come down and pen down their research, come forward and pen down their research. Now, lastly, Dr. Bajwa, if you could just share your recommendation or your piece of advice for young clinicians and researchers who wish to pursue anesthesia as their specialty.
You are asking a person who himself was not willing to take up anesthesia at that time. I was the one, looking for some other specialties like ortho, pediatrics, something like that. I took anesthesia because at that time, during my PG entrance examination, I went through that book of Lee synopsis of anesthesia, preparing for the MCQs. So when I took anesthesia, it was just an accidental thing. See, I thought I will take up anesthesia and I will again pursue the studies, the entrance examination. I will take up the choice of my. No, remaining 3 years, 3 months, 3 to 4 months in anesthesia, I was continuing pursuing the career option, and I gave the All India examination, got it cleared, 324 or 64 rank, something like that. I was getting almost everything, every specialty, not in Punjab, but in Rajasthan, hailing from Patiala, Punjab. I was getting almost in everything in Rajasthan. Somehow, at that time, I didn't feel like joining anything, because when I joined anesthesia, I was never aware that ICU is also a part of anesthesiology. And in ICU, I started feeling that the best practice of medicine is in the critical care. Nobody can match that critical care. I have been into a medicine person for almost in my internship in my GMC Guwahati. But here, when I saw the critical care patient, it tilted my thinking towards the anesthesiology. And I went on pursuing the career in anesthesiology. I read the book, the Bible of the anesthesiology, that Miller. People were a little afraid of reading that book. I read that book entirely in my career, in 3-year career of post-graduation. Cleared it. Then there were so many conceptual and technical errors in that book, which I pointed toward Dr. Ronald D. Miller, who was the editor of that book. And I got an appreciation from him and in the form of a letter. And he changed the entire edition, next edition, and rectifying all the mistakes. So that was the peak for me in 2003. And another thing, the book I read in post-graduation entrance, the Lee synopsis. So I got a chapter in that book now. 2022, I wrote a chapter in that book, Anesthesia for Endocrine Surgery. So you see, the journey which started as an accident or just not as a first choice, I went on to win the Best Young Anaesthetist of India award in 2012 also. So that journey really led to something the passion in anesthesiology, what I have got. And it's not that simple, that it's not my luck that I got into these things. As a youngster also, when I grew up, the sincerity was there, the hard work was there, honesty to yourself. You have to introspect yourself. You can't just, there are so many ways and means of climbing to the top. But we have to be honest with yourself. And it's not that my journey was smooth. Ups and downs will always come. There are people who will discourage you, people who will let you down. There are seniors who will never let you grow. But never take those into your heart for a longer time. See, everything passes with time. The better days always lie ahead. After, every night there is a day. So those days also pass out. In doing research, same thing happens. Your article may be rejected once, twice, thrice, 4 times. Previously when I used to write, I used to get a rejection almost at many places. Then slowly I got the knack of writing it. According to the reading the reviewers' comments, reading the editors' comments, I imbibed in my brain how to write the article in the best way, where were mistakes. So I kept on modifying myself, polishing myself, revising myself from internally. But that was the part of sincerity, honesty, and the hard work. You have to put it. It's not a one day. It almost took me 18 years to reach this level of publications where I don't feel like going to the indexing platforms to see what is my H index or what is my I factor, 10 factor, whatever it is. It's not required now, but it took a time to grow. The only thing is you have to be a very, very adamant in your approach and focus in your approach. Don't let other people supervene your mentality. I think, all 5 fingers are not equal. You may not be that strong, but just remember one mantra, that after some time, the bad days are going to pass. The good days will come. This is the only thing which I want to inculcate in the youngsters.
Great. Thank you so much, Dr. Bajwa, for joining us today at Medical Dialogues and sharing all your insights and about this new journal and encouraging more and more young researchers and clinicians to actually come forward and write down, get into research and encourage. And your piece of encouragement is definitely going to go a long way. So thank you so much once again for joining us today at Medical Dialogues.
Thank you, Anita. It was really a pleasure talking to you and giving all the insight out of me for this journal. This is another very close to my heart.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.